nephrologist is a doctor who studies how the kidneys work and looks after people with kidney diseases. And nephrologists classically provide quite comprehensive care. So aside from looking after the kidneys, because the kidneys tend to affect a whole number of other organs in the body, nephrologists tend to look after the full patient in general. At St. Joe's, as you know, our division has about 16 nephrologists, and a lot of us are leaders in the area of research, and a lot of us are leaders in the area of education in the country. So you become a transplant nephrologist by first finishing 3 years of your internal medicine training, and then you finish another 2 years of nephrology training, and then you do an additional 1 to 2 years of transplantation. And so it's in many ways it's a very different field where you have to learn a lot about immunology and how to look after those very complicated patients. As far as what is a transplant nephrologist and what's kind of involved in the education, one of the major things that we want to teach our fellows is really how to become a strong patient advocate, how to become a leader, and how to become an innovator. And so how does this fit in? Well, let's think about it. So as a leader, you're overseeing the care of the patient in full. So you collaborate with a whole host of other different physicians who feed back information to you, and then you and the patient can determine whether they're appropriate to go ahead with transplantation. As an innovator, you would have to decide whether it's appropriate for the patient to go ahead with the transplantation, the type of transplantation. So at St. Joe's, for example, we do a host of high-risk transplantations, such as ABO incompatible transplantations. We do very high-risk transplantations with regards to crossing antibodies, and so that becomes the innovation part of the learning. And the third thing, and the most important thing, is ensuring that the patients get the best care possible. As a transplant nephrologist, when you meet a patient, it's not a one-time visit. That visit and the collaboration with that patient goes on over years, and you're essentially overseeing the patient's care really till the end of their lives. So St. Joseph's Hospital Hamilton is actually integral in collaborating with McMaster University in ensuring the residents and fellows get an outstanding educational experience. So St. Joseph's Hospital in Hamilton is actually the largest teaching hospital associated with McMaster University. With regards to the kidney and urinary program, St. Joseph's also is the largest kidney program across the entire country. So those are very important elements in ensuring that residents and fellows get an outstanding clinical experience. The hospital has been integral in actually collaborating with the transplant program. For example, 2 years ago, we actually obtained American Society of Transplantation accreditation, which is quite a significant accreditation title, and it really required the collaboration with the administration at St. Joseph's Hospital Hamilton and the McMaster University Transplant Fellowship Program to obtain that. And then most recently, we obtained the Royal College certification, so Royal College of Physicians Surgeons of Canada certification and accreditation in solid organ transplantation. Only two programs across the country have that accreditation, and St. Joseph's Healthcare Hamilton is one of those two. So, without St. Joseph's Hospital administration, their ongoing support of the program, their ongoing mission to support education, really it's a partnership that eventually builds into outstanding patient care.